Can topical retinoids make acne worse? That's the question that we're going to discuss today. Welcome, I'm Dr. Arthur Colsky, founder and medical director of Advanced Acne Institute, and we like to share our insights with acne sufferers who are navigating the path toward clear skin. This is not medical advice, it's intended only for educational purposes. So, can topical retinoids make acne worse? So that's a common question that comes up. There are a lot of people using various types of retinoids. For example, tretinoin is a retinoid, adapalene is a retinoid, tazarotene is a retinoid. These are all different generic retinoid products that are used topically to treat acne. All of them have some things in common. For example, dryness of the skin as a result of using retinoids to treat acne is something that commonly occurs. And so we have to be very careful when we're prescribing these types of treatments, because if a patient uses them too aggressively, the skin can get very dry and sensitive and red and uncomfortable. So when we do use retinoids, we're very cautious and we like to prescribe them in a very slow motion way in the beginning, maybe every other day, sometimes every third day. So there are different ways of using these types of products. They do have that in common, that they can begin to cause the skin to become irritated. Another thing that can happen is we see in our patient population, patients coming to us having been given retinoids by a prior dermatologist that they were seeing, that their acne is getting worse. And the question is it the retinoid doing that? And the fact is that these products do in fact associate with worsening of acne in some patients. So we have seen patients just in the past month, for example, we've seen quite a few patients coming to us using various retinoids with very severe worsening of acne. As a matter of fact, some patients said they started with acne just in one area and they started using a retinoid that their dermatologist had given them, and all of a sudden they started having acne in areas where they never had acne before, and cystic acne developing. One of the first things we've done for our patients in those circumstances is to stop using the retinoid right away, because it was actually promoting worsening of acne and even causing acne to form in areas where there was no acne in the first place. And coupled with the irritation and dryness and redness that some of these medicines can cause in some people using them, it can become a very big problem for patients. And we have to take steps to mitigate all of the inflammation that's occurring in order to get them back to baseline. And we understand that some patients using these types of ingredients can in fact develop a flare of their acne. So we're very cautious and we watch for any of these types of developments very closely if we do use these types of products. So that's something important to know when beginning a treatment plan that incorporates one of the retinoid topical therapies.